Ray J, the well-known American singer, songwriter, and television personality now 45 years old, recently opened up in a raw and emotional Instagram live stream about a dire health crisis that has left him confronting his own mortality. After being discharged from the hospital, he spoke directly to his fans and followers, delivering heartbreaking news tied to years of severe substance abuse. He confessed that his heart has been profoundly damaged by long-term heavy alcohol consumption combined with extensive drug use, particularly Adderall and other substances. According to his own description, his heart is now functioning at only about 25% capacity, a condition he illustrated dramatically by pointing to his chest and declaring that the organ is essentially black and done. In the Candid session, Ray J made a stark prediction about his future, stating unequivocally that 2027 is definitely a wrap for me. This phrase, slang for something being completely over or finished, carried a heavy weight as he linked it directly to his physical decline. He explained that his body could no longer sustain the lifestyle he had maintained for years. He admitted to consuming enormous amounts of alcohol, describing it as like 4 or 5 bottles on a regular basis, alongside taking 10 Addies, a common street term for Adderall pills, daily. This extreme regimen, he said, eventually overwhelmed him, leading to a hospitalization for pneumonia where he almost died. The combination of these habits, he reflected, had pushed his system beyond its limits. Ray J delved deeper into his mindset during those years of excess. He believed he was indestructible, convinced that his physical build and perceived resilience would allow him to handle unlimited alcohol, Adderall, and other drugs without serious consequences. "I'm like, ain't nothing happening to me," he recalled thinking. That illusion shattered when reality hit. Up. I think I thought I had more weight. I thought I was big so I could handle all the alcohol, I could handle all the Adderall, I could handle all the drugs. But I couldn't. It curved my time here. This moment of self-reflection highlighted a common but dangerous misconception among those struggling with addiction, that personal strength or size can somehow protect against the physiological toll of substance abuse. The pneumonia episode served as a terrifying wake-up call. Being admitted to the hospital and facing near death brought the consequences into sharp focus. Yet even in earlier videos shared on Instagram, Ray J had already begun hinting at the severity of his condition while trying to project some optimism. He revealed that despite the grim diagnosis of his heart operating at just 25% efficiency, he was determined to turn things around. "As long as I stay focused and stay on the right path, everything will be all right," he said at one point, acknowledging that his health was far from okay. He expressed deep gratitude to fans for their support and prayers during his hospital stay, recognizing the outpouring of concern from those who have followed his career for decades. Ray J's career spans back to the late 1990s and early 2000s, with hits like One Wish and collaborations that kept him relevant in music and reality television. However, his personal life has often been turbulent, marked by public incidents, relationships, and controversies that sometimes overshadowed his artistic contributions. This latest revelation adds a layer of tragedy to his story, as it forces a confrontation with the long-term effects of choices made over many years. The damage to his heart isn't something that can be easily reversed. Medical realities suggest that such reduced function often requires lifelong management, lifestyle overhauls, and possibly medical interventions to prevent further deterioration. In sharing this openly, Ray J is not only processing his own fears but also potentially raising awareness about the dangers of addiction and polydrug use. Alcohol and stimulants like Adderall can place immense strain on the cardiovascular system. Alcohol acts as a depressant that weakens heart muscle over time, while stimulants increase heart rate and blood pressure, leading to cumulative damage. His admission that he thought I was big so I could handle these substances underscores a broader issue in society: the normalization of heavy partying in entertainment circles and the false belief that youth or fame grants immunity. Fans have responded with a mix of shock, concern, and encouragement, urging him to seek ongoing treatment and prioritize recovery. Ray J's willingness to discuss his vulnerabilities publicly could serve as a cautionary tale for others facing similar struggles. He has transitioned from denial to acceptance, admitting the mistakes that led him here while holding on to hope that focus and the right choices might extend his time. Whether 2027 truly marks an endpoint remains uncertain. Medicine, willpower, and support can sometimes defy grim prognosis, but his words carry an urgency that resonates deeply.